Hi, welcome to your checkup. We are the patient education podcast where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine doctor in the Philadelphia area.
And I'm Nicole Rufo. I'm a nurse.
And we are so excited you were able to join us here again today. So what are we going to talk about today, Nick?
Today we're talking about the kidneys.
Yes, talking about the kidneys today. It's good. It's good. Big on. That's a nice voice. I feel like that voice doesn't actually like offend anyone, and it's just like, I don't know. It's like a funny voice and clean for the air. So, yeah. Have you ever opened your blood work, scrolled through those results, and maybe suddenly you've seen that like your kidney numbers are highlighted in red?
No, I haven't. My kidneys are perfect.
Just like you. And so maybe you saw the creatinine is high. That's how you say that word. Maybe your EGFR is low. And a lot of times I have people wondering, like, are my kidneys failing? And these numbers that I find myself explaining this to a lot of people more and more because people have so much access to all their data, which they should, because kidney testing can be really surprisingly confusing. So we don't get a lab when it comes to the kidneys. We don't get a lab that simply says like your kidneys are working at 87%. But instead we get several different measurements that give us clues about what's happening. So today we're going to talk about three of the most important ones. Creatinine EGFR, which stands for estimated glomerular filtration rate, and urine albumin, or protein in the urine. And we're going to talk about what these actually mean, why your doctor looks at them together, and most importantly, why one abnormal kidney number doesn't necessarily tell us the whole story. So let's start with what the kidneys are actually doing. So you have two kidneys, and one of their major jobs is filtering your blood. Blood travels into the kidneys, where it eventually reaches millions of tiny filtering units called nephrons. Inside those nephrons are even tinier bundles of blood vessels called glomeruli. And you can think of the glomerulus almost like a very sophisticated filter. Did you like that? Yeah?
I was going to say, I haven't actually thought about that in like 10 years.
Yeah, I like this style of episode. I haven't thought about a glomerulus, and that's a tough one to say, guys. And as blood passes through, water and small substances can move across that filter. Your body can then decide what it wants to get rid of and what it wants to keep. And eventually, some of that material becomes precious urine. But your kidneys aren't just a garbage disposal. They're constantly helping control things like your body's fluid balance, sodium, potassium, acid levels, and even blood pressure. So they also play roles in making red blood cells and making healthy bones. So kidneys for the win. But the kidney function is incredibly complicated. So for today's episode, we want to concentrate on one job. How well are your kidneys filtering your blood? And that's where those two numbers, creatinine and EGFR, come in. So what is creatinine? We'll start there. Creatinine, geez. We'll talk later why I'm having a tough time here today. But creatinine is a waste product that is generated largely from normal processes involving your muscles. You are producing creatinine every day. It enters your bloodstream, travels to your kidneys, and your kidneys filter it out. So, but there's an assumption there, and that makes creatinine useful to us. If you imagine that you have a bathtub with the faucet running and the drain open, water is entering the bathtub, but it also is constantly leaving through the drain. If the drain is working well, the water shouldn't continue accumulating. But imagine that the drain starts to get a little clogged. The faucet is still running, water is still coming in, but now it can't leave as efficiently, so the water level starts rising. Creatinine gives us a somewhat similar concept. Your body is constantly producing it, and your kidneys are constantly removing it. If your kidneys aren't filtering as effectively, creatinine can begin accumulating in the bloodstream. So generally speaking, when kidney filtration gets worse, creatinine tends to go up. And that's why you see creatinine on such a large percentage of your routine blood tests.
That was a good analogy. Did you come up with that?
Yeah. No, I use that one quite a bit. Sometimes I'll draw a sink on the table, and then the medical assistants have to rip off the paper. I have done it a lot less at the new office for some reason, but
Don't they have to rip it off anyway if there's a new person coming?
they do. Sometimes I don't have people sit on the exam table though.
Oh,
I have them sit in a chair. I like it better.
I see.
Yeah. Gonna recheck the blood pressure again, the whole thing.
Mm-hmm.
Yeah. I do love that analogy, and yeah, no, I did. I was, this little guy came up with over here, So creatinine is not a perfect measurement of your kidneys, though. So let's say there are two people, both have a creatinine of 1.2. Does that mean that their kidneys necessarily are functioning the exact same? The answer to the rhetorical question is no, because the amount of creatinine. I keep seeing this, and a common thing is creatine. Like I want to say creatine. They're they're not the same thing by any means, guys. Creatinine. I actually had people come in and they're like, "Oh, I saw my creatinine was low, so I started taking a creatine supplement." And I was like, "Oh, interesting maneuver."
Oh, really?
Yeah, it happens. Because it really would be fun if this was a video at some point. Because anyway. So the amount of creatinine your body produces isn't identical from person to person. Muscle mass matters. Age matters. There are also clinical situations that can affect creatinine independently of permanent kidney damage. So that's one reason looking at creatinine by itself can be misleading. Your doctor isn't simply thinking, oh, creatinine is 1.2, therefore kidney's good, or creatinine 1.5, kidney's bad. We're trying to use that creatinine as a clue to answer a more important question of how well are your kidneys actually filtering. And so that's where we get the EGFR. EGFR stands for estimated glomerular filtration rate. And despite the intimidating name, the concept isn't too difficult. So we talked about the glomeruli before. Those are the tiny filters in your kidneys. The GFR is essentially trying to describe the rate at which your kidneys are filtering. So the problem is that directly measuring someone's GFR isn't particularly convenient for everyday medicine. So instead, it's an estimate, and that's hence the EGFR. We take the creatinine and we get some other information about you, including your age and sex, and put that information into an equation. It happens automatically in the background, and it's estimated how well the kidneys are filtering. But here's the distinction that I think I really want people to remember. Creatinine is something we measure. EGFR is something we estimate using that measurement. And that's why these two numbers generally move in opposite directions. So if your kidneys filter less effectively, creatinine tends to go up, and the EGFR tends to go down. So what does an EGFR actually mean? If we get into interpreting that a little bit, generally an EGFR of 90 or higher, I kind of like draw it on a table and I'm like, oh, this is like your kidneys filtering score out of 100. And 100 is a perfect score, but like if you're above a certain threshold, that's nothing to sneeze at or be upset about. But 90 or higher can be consistent with normal or healthy kidney function. And as EGFR decreases, we start thinking about different levels of reduced kidney function. So maybe you've heard of chronic kidney disease before. It's divided into stages. Those categories are useful, but there's a really important caveat here is that this is huge for everyone listening, is that one lower EGFR does not automatically mean you have chronic kidney disease. It's a very big misconception. Patients run into it when they're looking at their own labs pretty frequently. The word chronic is the thing that is important to think about there. So generally for someone or something to qualify as chronic kidney disease, abnormalities in kidney structure and function need to be present for 3 months. So your one-time decrease in an EGFR is like a picture of your body, like when you are getting blood work, but your body behaves much more like a video where it's coming and going and ebbing and flowing. So that was nice. I'm like Dr. Seuss, who can make a rhyme anytime. So then let's say you get sick.
About
you're vomiting, you're not eating, or you're drinking very much, you become dehydrated, and you have the blood work, and your creatinine has increased and your EGFR has fallen. Does that automatically mean you suddenly developed chronic kidney disease? No. Something acute may be happening, but that's why your previous blood work can be incredibly valuable. It's important to have normal stuff that you can refer back to. So what if I see an abnormal kidney number? Well, one of the first things that you want to know is that, where was it before? Let's say someone's EGFR is 55 today. If it was 54 6 months ago, or 56 a year ago, and 53 2 years ago, that's one story. But imagine that that same EGFR is 55, except 3 days ago it was 95. That's a completely different clinical situation. Same number, but very different meaning. And that's why doctors don't practice medicine by simply looking for the red numbers on your lab report. You're trying to look at the whole person and what's happening in the situation and the trend. So kidney numbers can change for a lot of reasons, lots of reasons for the creatinine to change. One common example is dehydration or changes in blood flow to the kidney. Certain medications can alter kidney blood flow or affect the creatinine measurement. And acute illnesses, muscle-related factors. There are a lot of diseases that can injure the kidneys too. So if your creatinine changes, the question really isn't becoming like, is this high? The better question is, why did this change? And sometimes answering that question means repeating blood work. Sometimes it means getting your urine checked, reviewing medications, or like starting a whole much larger evaluation altogether. You want to do this part? Oh, okay. So then there was this third part that we were talking about. Up until now, we've been talking about blood tests, but there's another important way we have access to assess your kidneys. I've actually been seeing commercials about this, which does not get me as upset about other commercials. When we look at your urine, we're specifically looking for a protein called albumin. And albumin is a protein that's normally found in your bloodstream. And your kidneys generally do a very good job of keeping important proteins, like albumin, in your blood instead of allowing large amounts to spill into your urine. So if we think about that filter again, you want the kidney to remove certain things, but you don't want to indiscriminately dumping valuable proteins out of your bloodstream into your urine. And if the kidney's filtering barrier becomes damaged, more albumin can begin appearing in the urine. And that's something we can actually measure. It's a common test. It's the one we're seeing in commercials now for people who have diabetes and hypertension and other various reasons, called a urine albumin to creatinine ratio. It's weirdly presented, though. I see it like advertised as a UACR, which I have never written a UACR in my life. And maybe that's a me thing, but like they make it sound like this sexy test, but like you're peeing in a cup. And this gives us information that your EGFR actually doesn't necessarily give us. The EGFR gives us like, how well are my kidneys filtering? The urine albumin asks, is there any evidence that the kidney's filter is damaged and leaking protein? They're related questions, but not exactly the same. So there's an important caveat that we wanted to jump in here with, is that someone can have relatively preserved kidney filtration and still have evidence of kidney damage. So if someone has a EGFR above 60, but repeatedly they have an abnormal amount of protein in their urine, that's not really great. That persistent, they call it albuminuria. Kind of, if you just put a urea at the end of it, just means it's coming from the urine. It can be evidence of chronic kidney disease, even though their filtration hasn't quite fallen. It's particularly important in people with diabetes and hypertension, and that's why we like check in on those every once in a while. So we're getting close to wrapping up here before we get to banterizing. And Nikki is here.
I'm petting my puppy.
She's petting the puppy. So your doctor actually wants to put this all together. So imagine I open up your chart, and not your chart. I'm not your doctor. Listen to the disclosure. And your creatinine is elevated. I'm tending to not look at the one number and immediately decide like your kidneys are dead. I'm sorry. I would want more context. I'm thinking, what is the creatinine? What's the EGFR? Where were they previously? Has this been present for at least 3 months? Is there albumin in the urine? Do Do you have diabetes? Do you have hypertension? Are you sick? Could you be dehydrated? What medications are you taking? There's so many questions to be answered. And depending on those answers, we decide what needs to happen next. Sometimes it's repeating something. Sometimes it's so complicated you need a kidney doctor. That's what they made them for. So, but not always. So the big takeaways. There's 3 things that we want you to remember when you're leaving this episode, learning about way more about the kidneys than maybe you ever thought you would. If you've made it this far, these are the things. Number 1, creatinine is a clue. It's a waste product that we measure in your blood, and changes in creatinine can tell us something about how well your kidneys are filtering. Great. Number 2, an EGFR is an estimate. We use your creatinine and other information to estimate your kidney's filtration rate. That's why you should think about creatinine and EGFR together rather than completely separate tests. And finally, number 3, kidney health isn't just about filtration. Thinking about that protein or albumin in your urine can give us additional information about whether your kidneys are being damaged. So when we're evaluating your kidneys, we're often looking at both sides of the equation. How well are they filtering? And is there any evidence of damage? And hopefully now the next time you open your blood work and you see the words creatinine or EGFR, those numbers will feel a little less mysterious. More importantly, if one of those numbers is highlighted as abnormal, don't immediately jump from my creatinine is high to my kidneys are failing. One number is one piece of information. Your previous results, your urine testing, your medical conditions, medications, and what's happening with your health right now helps us understand what the number actually means. And that's why these are great questions to bring up at your next checkup. Whew. All right.
Yeah, that one was a doozy, huh?
You think? I'm wondering how many people are going to enjoy this one. You're banterizing. We seamlessly went. We're banterizing now, folks. It's been 2 weeks since you've heard from us banterizing.
Yeah.
Gosh, lots to update. I do have to say, because I know last week was like a more serious episode, and I just didn't want, like, I don't know, vaccines are kind of like a hot topic, and I didn't want like our fun,
So our puddle jumpers.
our puddle jumpers. I didn't want like our fun little life to be attached to what could be a charged episode for some people.
Yeah.
Those people who are ill-informed. Well, obviously there's like so much to talk about. We got to hit the highlights. I love Ocean City, New Jersey.
Oh yeah, we had a cute little boardwalk date. That was so fun.
I felt like a kid in a candy shop. Actually, we did go to a candy shop because you love gummy candies and fudge.
Oh, you liked the fudge too.
Clearly, I liked the fudge too. Have you seen me? I'm kidding. I try to keep a lean physique, folks.
I love a candy store.
You do love a candy store. It was great. You love a saltwater taffy as well. My concern with saltwater taffy is that it's going to pull my teeth out.
Well, like, so they're like harder, but then once they're like in your mouth, they like soften up.
Maybe I've always been too aggressive on the chew.
Yeah.
Yeah. So we loved that. And we got one of everything on the boardwalk.
We did.
And the mummers were there. We stumbled upon Ocean City on Mummers Night, which is cool.
Never too far from our country of Philadelphia.
I think it's so funny when you refer to it as our country, Philadelphia, specifically like when we're
at home.
When we're getting up the Ben Franklin, and it's like, yes, back in our country of Philadelphia. Oh man, you're funny gal, Rufo.
Yeah, that was fun. I wonder if Frankie and Vanessa would want to do a boardwalk day if they're down for Labor Day weekend.
I love them. Sometimes I feel like they need to be entertained.
Frankie definitely needs to be entertained.
No,
Vanessa can like hang out in any
Hang.
situation.
Yeah, and just like.
All right, brother, when you hear this, text us. Let us know what you think.
Yeah, Frankie needs to be entertained though.
Yeah.
It's Busy Bee.
He can like ride it. What were those things?
Go-karts?
Yeah.
That was fun. I just felt this pull. I felt a gravitational pull to the go-kart.
It was fun.
That was so fun.
I was getting lapped by 12-year-olds, but
you were like driving Miss Daisy. Well, that was like probably the second time.
I was being safe. There was no head protection.
second time you drove in 2026?
Yeah, and the first one was like, when was that? The weekend before, when you were out for the day at the beach, and I was, where did I go? I drove to the gym.
Yeah. How disorienting was that?
It was kind of weird. Like, because I'm living this life where driving is, I don't have my car in the city, so, because I don't drive anywhere. I walk to work. And then if I have to drive anywhere, you're driving.
Yeah.
So, yeah, like I've been living this life where I am just in the car, not paying attention, and I arrive to my destination. But then I was like, oh my God, I need to pay attention. And then it was the triathlon that day. So I was like rerouted, but I like knew where I was, obviously. But then I was like, oh my God, how do I get there?
Yeah, you I mean, partial. You guys might be wondering, like, wow, he does all the driving. I do, and part of it's because it's a blue job.
It is.
Part of it's because I get viciously car sick if I'm not driving, which is a bummer. Here's a little click clack. He's doing well.
Our patient.
He's doing well, and he's our patient.
Did we talk about that already?
We didn't. No, people don't know.
Oh, he had a little eye surgery on Thursday.
He did. They're great. They did an awesome job.
Yeah, he looks so good.
Huge credit to them.
I was really prepping. I need to give him his trazodone. I think he's getting too. What are you doing, bud? I was like fully prepping for him to be botched because he had this like, what's it called?
Myopian gland. It was
like benign little.
Yeah, a benign upper eyelid thingy.
Yeah.
But it was kind of big according to them.
Mm-hmm. So we got it removed. He's doing great. He's going to be really mad when he has to wear the big hard cone all day long.
Oh, I know. That poor guy.
Yeah.
No, but credit to them. They did a great job. They really took care of us. There's a little like scheduling thing and like came in on their day off. They're awesome people. Yeah. I did have to drive there after work. That's fine.
Yeah.
That's fine. There are worse things in the world. All right. So he's doing great. That's good. Thank you for your thoughts and prayers for our Ollie pie. We actually don't need that. He's doing great. He's doing fine. You could send them elsewhere. Maybe you could send them to, I don't know. I'm just going to pivot off of that because I have no idea. It was like an attempted transition and I just botched. Speaking of botched the transition. What else should we speak on? The show?
Yeah, we could talk about our show, The Undoing.
Yeah, I've been trying to. Me and Chat are really tight. I am now using Chat to find TV shows because you say, Eddie, find us something to watch, and like in the wide world of the internet, there's a lot of things to watch. So, in the theme of rich people behaving poorly, we found The Undoing. How do you feel about The Undoing?
It's good. It didn't grip me as immediate as some of the other shows we've recently watched, but it's good.
I almost turned it off.
There's like rich people and a murder. It's, can't go wrong with that combo, honestly.
I feel like we did like 2 rich people and murders in a row.
Yeah, we did.
It's good. I like it. It tickles the brain in some weird way. So I gave it a 10-minute warning in the first episode. I was like, I don't have anything else in me. Like I don't know what's happening or why this is all happening this way, but like,
and then someone dies and we're like, all right,
I'm like,
we're back in it.
What happened? Why did she die?
Pourquoi?
Pourquoi? So that's great. A spicy little show, and got to go to a bachelor party again in the Poconos.
Again. Eddie left his loving family all weekend.
Guys, this gets put on the calendar.
With your post-op son.
I know. I felt really bad. But it was an important one, though.
It did get put on the calendar.
It was Eddie leaves his loving family again.
With a smiley, or not a smiley, a frowny face.
That's what happens here, folks. Like, I don't know, like meetings don't go on the calendar. It's like, it's this type of thing.
Did you see what I put on for the Sixers game?
Oh, no, I didn't. I didn't see it yet. I knew it was under there, but it was kind of like a couple flips, and I didn't get the chance to. My squirrel brain, I didn't do it. What did you put?
I put Mike and Eddie kiss LeBron.
That's awesome. Mike is
Mike.
Basement Mike is one of the best human beings to have
coming
ever
out of his
existed.
basement to go to a Sixers game.
He's the best.
It's a pretty sweet basement he has, though.
That's it. I don't understand how he put it together so fast. He moves in silence. He really does. He's like,
he's just up in the night putting all his Eagles paraphernalia on the wall.
yeah. Or he's like, hey guys, by the way, I'm not in the state randomly for the last 4 days. And like, I don't know. I like pretty much talk to him every day. And I'm like, oh, you have left the basement? You're not in the basement. You're actually on a boat. That's crazy. I was shocked. And then like all of a sudden it's like, boom, new house. Oh, great. Congratulations. Boom. New other thing. I don't want to like share all of his life, but no, he's the best. Let's see what else. That's great. And oh well, I was part of a bachelor party is ending male loneliness. I learned this when we went to Portland, Oregon, for my friend Sam.
You would learn about male loneliness in Portland.
Well, I think you misunderstood the male loneliness. Like, I'm not lonely because I have you guys. But like,
I know he's like, we're ending male loneliness. I'm like, literally all of you are married, about to be married, or like have a serious girlfriend that they live with.
No, it's like, it's male companionship, which I was saying male bondage a lot this weekend, which of course is a misnomer.
Yeah. Yeah, it is.
It is, and we rolled with it. All of the like guys, great weekend texts, they all included something about male bondage. Do you think this is like pushing the limits on? I don't know. I think it's fine. The people are gonna like it. Great community this weekend. Very happy. It was AJ's bachelor party, my oldest friend and very dear friend. So they are getting married, and two of my closest friends, both of them are getting married to each other, which is a very cool thing. We all grew up together, so congratulations to them. One of the 3 weddings that we are going to.
Yeah.
Which is going to be such a fun time. And we're going to quickly move off of that topic before anything else. All right. Any other thoughts, Nick?
I don't think so.
All right. Well, thank you guys for coming back to another episode of Your Checkup. Hopefully, you were able to learn something for yourself, a loved one, or
a neighbor's kidneys.
You can find us on Threads, Instagram. You could send us an email. Please consider leaving a review. It doesn't have to be long. If you learned something and you liked it, maybe just write that. It would help us out, I think. But anyway, most importantly, stay healthy, my friends. Until next time, I'm Ed Dulesky.
I'm Nicole Ruffo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for a complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.